Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl. I wanted to jump on today to talk about an important topic that we addressed at the amazing Let's Talk Menopause Symposium. Here's a picture of me and some of my colleagues and friends who were part of the symposium in Chicago. We call it a Menoposium. And basically, we discussed issues around midlife women and a transition as hormone deficiency happens in our bodies and what to do about it and myths around it. And my panel was specifically on the genitourinary syndrome, menopause, and sexual dysfunction when it affects your genitourinary system. And years ago, I did a video on that because I've been talking about this for at least 10 years now. But today, I want to discuss it. I mean, you guys have seen my vaginal estrogen discussions, and you know how I feel about vaginal estrogen when it comes to being life-saving and the genitourinary syndrome of menopause and how it can impact your quality of life and your sex life. But I want to talk about, in a broader sense today, the genitourinary syndrome of hormone deficiency, because many of you might not realize it doesn't just impact midlife women. It can happen postpartum. It can happen after infertility treatments. It can happen when you're getting oncology treatments for cancer. And so there's different times in your life when you have some hormone deficiencies. It can happen to women on birth control, which we've talked about. So let's get at it. Let's get into it. Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl. Excited to talk to you guys today about another topic that I'm going to dive into and reiterate today. I want to just remind you of who I am. I'm a sex med gynecologist and menopause specialist in downtown Chicago. I have my own private practice. I have a podcast I launched this year called Gyno Girl Presents Sex, Drugs, and Hormones, which I have interviewed some patients of my own, as well as individuals telling their stories and some expert colleagues and friends. And I am a clinical assistant professor at the Northwestern Feinberg School of Medicine. So today I wanted to dive back into the genitourinary syndrome of menopause. I was at an event about 2 or 3 weeks ago for Let's Talk Menopause. And it is an advocacy group run by a bunch of women who have gone through menopausal changes, and they were just sick of not having good information. I'm on their medical advisory board as well as other colleagues and friends. Let's Talk Menopause. Donna Clausen is a social worker who kind of spearheaded this, and they've been really prominent and involved in the movement to, get more legislation for menopausal research, get more education to clinicians and to patients so that they can advocate for themselves. And like I like to say on my podcast, I'm here to educate so you can advocate. So that's what we're all about, and it was a great event. So I wanted just to dive back into the genitourinary syndrome of menopause. Like I said, I talk about vaginal estrogen a lot, so you guys know I'm a fan. But let's try to understand that it's not just a midlife issue, although we know that it affects, over 80% of midlife patients, and it's a chronic progressive condition. It gets worse if untreated over time. And so we're going to talk about why it happens and who else it happens to, because it happens to women who are lactating. It happens to patients who are on birth control pills. It happens to patients who have had their ovaries removed and entered premature menopause. It happens to patients who have oncology treatments and have entered into like a chemical menopause. And so it is not just about midlife women. I think that it's very important that we emphasize that because it can happen to a variety of patients. I like to call it the genitourinary syndrome of hormone deficiency, because it can affect different aspects of your life when you are deficient for the hormones. So as you guys know, we talk about estrogen and how important it is from head to toe. We always say receptors are everywhere. And we're going to focus in on the genitourinary system. So that's your bladder, your ureter, your pelvic floor, your vagina, the vulvar vestibule. Remember the vestibule? I always love talking about the vulvar vestibule, that little area of tissue you have to pass through to get into the vagina. So if there's something wrong with that vestibule, you're going to have pain and you're not going to be able to get in. The pelvic floor is very vital as well. We had a wonderful pelvic floor therapist, my friend Stephanie Prendergast, on the committee, and it was wonderful to have her there to talk about the importance of the pelvic floor when it comes to these genitourinary complaints. But what happens when you become deficient of estrogen and testosterone, right? Because remember, when midlife women enter perimenopause, menopause, particularly past menopause, they will have a deficiency of testosterone, up to 50%. And so for some patients, this is very impactful on them. Other patients that might experience this, we know that patients who are lactating, who are breastfeeding in that postpartum period. If you're not, have never been postpartum or you remember being postpartum, you may remember a period of time where you had really difficulty with intercourse. Whether or not, and I did talk about fourth trimester sexual dysfunction many times on this, so we can go back to those episodes. But, when you have that estrogen deficiency and you're losing testosterone as well, what happens? Your bladder responds, right? So you can get urinary urgency, frequency, getting up in the middle of the night. You can have this reduction of elasticity in the vagina, right? Because the collagen and the fibroblasts are really important for elasticity in the vagina. And so when you lose that elasticity because of the lack of estrogen, it becomes a big problem for the vaginal tissue. It becomes very thin. It becomes what we used to call atrophic. Nobody wants to hear that their vagina is atrophic, that it's useless, that it can't be used anymore. So in 2014, that's why the genital urinary syndrome of menopause changed or became the term that we used, because prior to 2014, people were just told that their vagina was atrophic, which is no fun to hear. But it happens to women in midlife. We know when you lose that estrogen, it becomes progressive. People can get those significant symptoms. You also have a change in the pH of the vagina. So the pH goes from being acidic to basic. And along with that, you lose your natural vaginal microbiome. I love talking about the vaginal microbiome. It's so important. I think we're going to learn so much about it. But, you lose that normal lactobacillus. And so we end up with a basic environment, getting more infections, getting a feeling of vaginal dryness, lack of lubrication, painful sex. Let me grab my vulvar puppet. Remember, we talk about the vulvar vestibule. Here we go again. You got the labia majora, your labia minora, the clitoral hood, the clitoris. We got to make sure we can retract it back. And then we have this whole area here, which is your vulvar vestibule. It's from your inner labia minora extending to your hymen remnant up to the urethra. So these areas around the urethra where you pee from, this part of the vestibule becomes very sensitive for a lot of patients, and they feel like they're having UTIs all the time. And a lot of patients do get UTIs, right? When you have that estrogen and testosterone deficiency, the vestibule has both estrogen and androgen receptors. And so that is why when you lose the hormone or when it's suppressed, for instance, like patients who have oral contraceptive use, some patients have androgen receptors in the vestibule that are very weak. So when we suppress their androgens by taking oral birth control pills, maybe they have acne, maybe they have concerns of facial hair, they're on this medication or they're on spironolactone, we're suppressing their androgens. You need androgens for that vestibule, for that clitoris, for that vulva, for that vagina. We have testosterone receptors in our vagina as well. And so once we lose that, then the tissue starts changing. It becomes thin, it becomes red, it becomes angry. Pictures here. And so you can't get past that vestibule, right? And then what happens? Your body automatically clenches. You start having pain with sex, and the pelvic floor muscles become hypertonic. They become shorter, they become tighter, they become less well oxygenated, and we end up with a lot of burning at the opening too. When I do what's called the Q-tip test, where I check the vestibule on every single one of my patients, I'm checking, at 12 o'clock, at 1 o'clock, at 11 o'clock, at 9 o'clock. So we consider this like a circular clock, that vulvar vestibule. And I just take the soft part of the Q-tip and I test the whole vestibule. And people that have hormonal deficiency or nerve proliferation or other issues around their vestibule feel like that soft Q-tip is like a knife, or if I'm cutting them. And so it's a very alarming feeling for a lot of patients. And so the same thing happens for a subset of patients that go on birth control pills. They can get that provoked vestibulodynia, like I talked about in another episode, causing that sexual pain. Your muscles then react, they become hypertonic. And then you might start having involuntary contraction of the pelvic floor. Oh my God, that's vaginismus. And then, you might not have any penetration. And that happens to a lot of patients who are hormonally deficient. See, this happens also to patients who, like I said, have had, who are lactating. So when you do breastfeed, your prolactin level goes up, your estrogen levels go down. That impacts your sexual function a lot. And so it's a very similar syndrome. You get very similar changes in the vulvar vestibule. Compound that, like I said in my fourth trimester talk, with the idea that now you're not sleeping well, that you have a new baby that you're worried about. that your hormones are fluctuating, and then that's why sexual dysfunction happens in that postpartum lactational period of time, that 4th trimester. So there's that. And then there is obviously the perimenopause, menopausal period. There are patients who are on the birth control pill. Then you have the oncology patients who are on medications to suppress their estrogen, to suppress their progesterone, to suppress all their hormones, the aromatase inhibitors, tamoxifen, and the like. And so, it becomes a very, very painful environment for them. So sexual pain, vaginal dryness, vaginal irritation, not feeling like yourself down there. My patients tell me all the time, all the patients that I treat with these genitourinary syndrome of hormone deficiency, whether or not they're postpartum or they're on birth control pills, or, the majority of my patients that are midlife tell me that their vagina has just gotten so damn high maintenance, because I tell them to use, obviously, vaginal estrogen or vaginal DHEA. Sometimes if their vulvar vestibule, that opening is super red, or like this picture, super red, super inflamed, very tender to touch. Even wearing tight clothes or, your workout clothes can make it like very painful for them. So they're like, man, Dr. Rahman, my vagina has never been so high maintenance. But guess what? They use the medications, they get better. You guys can go to my vaginal estrogen talk to hear how important I think vaginal estrogen is. Remember, 25% of geriatric hospitalizations are due to UTIs. Vaginal estrogen can prevent UTIs, right? Because what's happening in the urethra, when you have that change in the vaginal microbiome in the vagina, those bad bacteria can jump into the urethra. Here's a picture of a urethra without estrogen. Look how prominent it is, how red it is, how inflamed it is. And so, the changes in the urogenital system as well can make you susceptible to urinary tract infections. And the tissue changes, and then the bacteria that accumulate can get into that urethra, cause a lot of urinary tract infections, which can be prevented with vaginal estrogen. And 6% of those geriatric hospitalizations due to UTIs result in death. And that is why I say vaginal estrogen is life-saving. So there's that. There's the patients who are on the birth control pills, and then the patients who are on oncology regimens to suppress their hormones, the patients that have had infertility treatments, up and down roller coaster, right? With infertility treatments, you're trying to suppress hormones, then you're trying to load up on hormones. So there's a lot of that happening for them as well. So a lot of times they'll have these transient changes in their genitourinary system. So remember, this is a condition that is easily treatable, that it does take, for at least women in midlife, it's chronic and progressive. For patients who are postpartum, usually after you're done lactating and you've treated your pelvic floor and you've treated vaginal estrogen or DHEA. Remember, I love DHEA because it converts into estrogen and testosterone in the vagina, and you have both receptors there. So that's why I'm always like, if I could give DHEA to everyone vaginally, I would do it. But sometimes insurance doesn't allow that coverage. So, we know it spills into the vestibule, and it helps that vulvar vestibule, which means the androgen and the testosterone and the estrogen. So that's very important for patients with that genital urinary syndrome and hormone deprivation, right? Urinary symptoms, frequency, urgency, vaginal symptoms, dryness, irritation, sexual pain, penetrative pain. So whatever you're trying to penetrate with, is it getting an exam? Is it getting a speculum? I'm going to do a whole discussion on different types of lubricants that are important to know about, because I think there's a lot of lube shaming out there, which shouldn't happen. And I'll also do a discussion on Viagra. That's my next discussion. It's going to be on Viagra and the importance of it, or is it important for women? So we will talk about that. But I wanted just to show some pictures, review that this is a genital urinary syndrome of hormone deficiency. So it can happen in lactation, that it can happen in those patients that are breastfeeding, it can happen in those that have been on birth control pills, and they have just the perfect storm of things happening where they have some receptor deficits at the vestibule. Never forget how important your vulvar vestibule is. And, patients that are oncology patients, patients that have had an early removal of their ovaries, an oophorectomy. These are all patients who are susceptible to the genital urinary syndrome of hormone deprivation or hormone depletion, whatever you want to call it. One day they'll change the name. But I wanted you guys to just remember that. I wanted to show some pictures and go back and look at my vaginal estrogen can save your life talk, or what vaginal estrogen is right for you. I go through estrogen rings. I go through estrogen pills in the vagina. I go through DHEA. I go through estrogen gels and all the other potential treatments. There is something called the Mona Lisa Touch, which is a CO2 laser that has been studied in these hormonally deficient states. There's not enough data to suggest that it's better than estrogen, but I think in the right patient population, that can be utilized to improve fibroblasts in the vagina, which then converts into collagen, improve blood flow to the vagina. You're also, when you lose that estrogen and testosterone, you're diminishing blood flow. So there are some patients that, have used the Mona Lisa Touch, the CO2 fractionated laser, to the vestibule and the vagina with some success. And that is an alternative treatment. Remember, there's also oral ospenephine. So you can go back to my previous videos to review that. But I wanted to review this because it was a big topic of discussion at the Let's Talk Menopause, the genital urinary syndrome menopause, genital urinary syndrome of lactation, and I wanted to show you, or a hormone deficiency. Oh, my friends just reported on why this is so similar to patients who are postpartum and lactating, and they actually refer to it in that scenario as the genital urinary syndrome of lactation. Here's the article that just came out a couple weeks ago. Hopefully you guys understand that it's a hormonally deficient state. It can happen to patients at different times in their life. We know it affects midlife women the worst, but we shouldn't ignore our postpartum, our cancer patients, our patients who have had fertility treatments, our patients on birth control pills, and the like. So hopefully you learned a little bit something again. This is one of my favorite topics to talk about. I've talked about it for the last 10 years ad nauseum. So hopefully you learned a little bit something and you'll take it back to teach someone else, or take it back to your doctor to talk to them about it, depending on what state you're in terms of, are you postpartum? Are you taking birth control pills? Do you think this is affecting you? And or have you had cancer treatment? Whatever the case may be. Join me next time. We're going to talk about Viagra for women and is there a purpose to using it? And you might be surprised. So I'll catch you guys next time. I'm here to educate so you can advocate. Please join me for my next video as well as my next podcast. Thanks so much.